MedsCK is a platform that has been designed to enable a pharmacy to implement a MedsCheck service easily and quickly. The features of MedsCK that distinguish it from GuildCare are firstly its ease of use. MedsCK has a much simpler workflow. A pharmacist can manage and complete a MedCheck faster in MedsCK than in GuildCare. MedsCK also has a greater emphasis on managing and building your MedsCheck service. It includes an inbuilt scheduler, SMS appointment reminders to consumers, daily run sheets, email follow-up reminders for pharmacists, claim management, management reporting, plus more. MedsCK does not require any software to be installed on your computer, and it won't slow your dispensing system down. MedsCK is a web-based application. It requires no software to be installed or maintained. All you need is an internet connection and you can start using MedsCK straight away. You can have a MedsCheck system running in your pharmacy in a matter of minutes. In this video, we illustrate the basics of MedsCK. At the end of it, you'll be able to implement MedsCK in your pharmacy and complete your first MedsCheck. Step 1 is to create your free Medscope account. If you are a registered MRM user, log in using your MRM credentials. Otherwise, click Sign Up and enter your pharmacy's email. If you do not already have a Medscope account, you will be directed to the Create Account page. Complete the details and press Submit, making sure you have read and understood the terms and conditions. You will receive a registration email within minutes that has a Confirm link. You will need to click on that link to activate your account. If you don't see the email in your inbox, check your junk emails. Using your confirmed account details or your existing MRM account, log into MedsCK. You now have implemented a MedsCheck system and have access to the free version of MedsCK that allows you to complete one MedsCheck a day. You can log into MedsCK on any number of computers using the same account details. For example, you would have MedsCK running in the consultation room computer, the front counter computer, and perhaps the dispensing computer. You may also log in from home to view the management and performance reports. MedsCK can be accessed by multiple pharmacists at the same time. No additional licenses required per login. Before undertaking your first MedsCheck, there are some settings that need to be configured for your pharmacy. Click on the My Account tab to access MedsCK's preferences. Complete and save the account details. You will also need to complete your claiming details, which are required so MedsCK can generate the claim forms. You can add your own logo to appear on letters and consumer information sheets. If you are planning to upgrade to the full or premium versions, you will also need to configure the alert options. Alerts are not active in the free version. MedsCK has alerts for follow-up reminders. Consumers are funded for one MedCheck every 12 months. MedsCK will send an automated email to the specified address listing consumers who are due for follow-ups within, in this case, the next 5 weeks. MedsCK has an inbuilt letter generator that will allow you to send follow-up letters to these consumers. The Action Plan Task Reminder is an automated email that lists the pharmacy considered tasks recorded during a MedsCheck that are due. And finally, the SMS Reminder is a service that sends SMS reminders to consumers who have a mobile number recorded, reminding them of the scheduled MedsCheck appointment time. Data entry accounts, services and the library option are not required to complete your first MedCheck. These can be configured later as your MedCheck service grows. Services allows you to list other professional services being offered by the pharmacy. These could include HMRs, smoking cessation programs, weight loss programs, etc. MedsCheck has a mechanism whereby the interviewing pharmacist can recommend other services to the consumer during the MedsCheck. The library is a store where the pharmacy can record all their consumer information leaflets. MedsCheck provides the pharmacist with a mechanism to search and print items from the library for the consumer during the MedsCheck. We'll demonstrate how services and the library can be accessed when we do our first MedsCheck example. Use the data entry accounts to set up separate logins for your pharmacy staff. You can set up individual accounts for each staff member, but we recommend setting up a generic pharmacist account for all your MedsCheck pharmacists and a generic assistant account for your front of shop staff so they can access MedsCheck to schedule and manage appointments. Okay, now for our first MedsCheck. The appointment book is the main working screen. To conduct a MedsCheck walk-in, click on the New MedsCheck button, which bypasses the scheduling process and goes straight into the MedsCheck interview. For our example, however, we will schedule a future appointment. To schedule, click on a free time slot on the appointment book. Each time slot is divided into 30-minute blocks. Click on Make Appointment to schedule on the selected time slot. A MedsCheck begins by first checking the consumer's eligibility criteria. If the criteria is not met, MedsCK will not allow the appointment to continue. If the criteria complies and the consumer gives verbal consent, MedsCK schedules a MedsCheck and requests the appointment details. Patient and doctor details are linked to a central address book. Details can be imported from your dispensing system, or you can create a new contact. If the phone field is populated with a mobile number, MedsCK will automatically send the consumer an SMS reminder according to your alert preferences. For the doctor, we'll just pick one of our test doctors from our address book. Note that a fax number is recorded for this GP. This becomes relevant if a copy of the action plan and meds list is to be sent to the consumer's GP. The last step is to nominate the pharmacist likely to conduct the MedsCheck. This can be changed to the actual MedsCheck pharmacist when the MedsCheck is conducted. Click Next when all the details are completed and MedsCK will create the appointment slip for the patient. The appointment can be changed by dragging to a new time slot or editing to update any of the details. Let's now assume it's the morning of the 16th of April. One of the assistant's tasks is to prepare for today's MedsChecks. The assistant will log into MedsCK using their data entry account credentials, remember we covered that earlier, and print the daily MedsCK run sheet. Good practice will have the assistant confirm the appointments, thus reducing the risk of no-shows. And then generate the consumer meds list from the dispensing system. In some busy pharmacies, the assistant may even enter the meds list into the consumer's MedsCK profile ready for the pharmacist during the interview. Data entry in MedsCK profile screen, that is the meds list, medical history and action plan, have been optimized for fast data entry with context-sensitive lists. Items from the list can be selected using the up-down arrow key, and the tab key is used to move between fields. A new blank record is automatically added when the user tabs out of the last field in the row, in the case of meds lists, the comment field. Data entry can be completed entirely from the keyboard, avoiding the need to continuously switch between keyboard and mouse. At the scheduled time, the pharmacist would invite the consumer into the consultation room, log into MedsCK and begin the MedsCheck. The session begins by formally screening the consumer for eligibility using the approved PSA screening tool. The consumer's MedsCheck profile is then updated. As with the data entry of meds, medical history uses context-sensitive lists which are activated when the first few characters are entered. The list option narrows with every additional character until you find the item you are looking for. Tabbing out of the Notes field creates a new medical condition record. Text added in the Health Provider Notes field are included in the action plan faxed to the GP. Notes for the patient are included in the Managed Plan which is provided to the consumer, and notes for the pharmacist are accessible to any follow-up MedsCheck that may occur in 12 months' time. The focus of the MedsCheck is the creation and documentation of an action plan. The action plan consists of a number of agreed tasks to help the consumer better understand their medication and to ensure that their meds are being administered as per the GP's prescribed directions. To save having to jump between screens, MedsCK maintains an issues list that contains the meds and medical history just added. An action task can be entered specific to a medicine or a medical condition. A task can also be added to address a general health, adherence or education issue. The other option allows the pharmacist to create an action task for any other issue not listed in the Issues drop-down. The other required output of a MedCheck is the provision of education and/or information literature. MedsCK maintains a leaflet library that the pharmacist is able to search and include in the consumer's MedsCheck documentation. In addition, the pharmacist may also recommend other health services provided by the pharmacy. When the interview has been completed, click Next to print the consumer action plan and meds list. The pharmacist can fax a copy of the action plan to the consumer's GP, print the selected information sheets, print the brochure for recommended health services, and finally print the claim form that must be signed by the consumer in order to be able to claim for the service. We have just completed your first MedsCheck. Before we end this video, it's worth having a quick look at some of the other modules of MedsCK. Homepage. Tasks logged in action plans for the pharmacist's consideration that have a review date are listed in the outstanding task lists. Completed follow-ups can be ticked so they can be removed from the list. Above it we have a snapshot of the MedsCheck volumes over the last 10 weeks. The MedsCK claim management module is accessible from the link on the right hand side. From here, the pharmacy is able to print the claim cover page for MedsChecks completed in the selected period and track which claims have been paid and which haven't. The Search tab allows you to search through current and past MedsChecks to either reprint the action plan or review the MedsCheck interview and consumer profile. That just about wraps up the introduction video to MedsCK. For further information, please contact Medscope either by email or phone.